everybody, it's Dr. Joe, and today I'm going to show you some stretches and exercises for facet joint syndrome. Let's get started. Disclaimer alert, disclaimer alert. So the facet joints are the little joints in your spine that help it bend and twist. So not where the vertebrae are, but the little joints on the back. So when those are inflamed and irritated, it makes it really painful to twist and bend and do things like that. So we're going to start off with some stretches on our back. My sock is falling off. And just to start off, we're going to do a simple knee to chest stretch. So this is the one where you want to grab underneath. Some people grab on top, but if you happen to have any knee issues, make sure you grab underneath and then just pull your knee towards your chest as far as you comfortably can and hold that stretch for about 30 seconds. And then after the 30 seconds, switch sides, hold that stretch, nice big pull. You should feel it underneath that lower back area a little bit, and then do that 3 times on each side. Then you're going to go into some pelvic tilts. The pelvic tilts are the ones where you want to kind of flatten out your back, tighten up those core muscles, almost like I like to call it when you're fake laughing, when you go ha 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 ha, and those muscles tighten up. But you want actually movement in the pelvis. So if you're just squeezing and it's not going anywhere, that's not quite the movement. You want to actually tilt it back and flatten out your back. So it's almost like if someone had their hands there, or your hands, you're trying to squish it into the ground. So hold that for about 3 to 5 seconds and then do 10 of those. Then you're going to go up into a bridge. So just bringing your hips up until your body's pretty flat in the air. So coming up, and then when you come back down nice and slow. That's the important part. Almost one segment at a time. So you're really stretching out those facet joints as you go. And then same thing coming up, nice and controlled, slow coming up, and then slowly coming back down. So same thing, do about 10 of those to start off with. Now we're going to flip over and go into a child's pose. So with the child's pose, spread your knees out just a little bit so you can come down. Put your arms out in front of you and just take your bottom down towards your heels and then come down as low as you comfortably can. You might not be able to get quite as far as me if you're not as flexible, but go down as far as you comfortably can and hold it for about 30 seconds. And then come back up and then do 3 of those. The next one is going to be a little bit of a rotation stretch, but you want to stretch the upper part of your body versus when you're lying down and you're rotating your legs. This time we're going to rotate our arms. So you're going to be in this quadruped position and then take your arm and bring it underneath and pull through. So you're rotating that upper body to get that stretch. And for this one, you can just hold it for about 3 to 5 seconds and then come up and then rotate the other way. So going about 3 to 5 seconds, doing 5 on each side. Now we're going to go into some quadruped exercises, and you can start off pretty slow, just doing maybe the arms first, but make sure your shoulders are pretty much in line with your hands. So you don't want it way out. There's a hair. Or you don't want it way under. You want it, pretty straight up and down to protect your shoulders. And then you can start off with something easy by just doing the arms, kind of alternating back and forth, keeping your back nice and flat so it's not sagging down, it's not coming up. And then you can just do your legs, a kick out, alternating back and forth, just maybe doing about 10 on each side. And then if those become pretty easy, then you can do opposite arm, opposite leg. So some people call this the bird dog, but trying to keep your back pretty flat, like if there was something on it, you wouldn't want it to fall off. So you're not leaning over one way or the other. You're really working on those core muscles. And then the last stretch is just the cat stretch. So still in all fours, and you're gonna arch your back up and tuck your chin in, just like a cat stretching. and then hold this one for about 15 to 20 seconds and do 5 of those. So big hold, getting that bend, getting that movement in those joints, and then coming back down. So there you have it. Those were your stretches and exercises for Facet joint syndrome. If you have any questions, leave them in the comment section. If you'd like to check out some other videos, go to AskDoctorJo.com. And remember, be safe, have fun, and I hope you feel